Hello, I'm Dr. Omar Bay, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we're here again, and we have a wonderful show for you tonight. We're going to talk about pharmacy. But before we get to the main topic, I'd like to talk about our usual sharing and caring. Remember, guys, coming together, sharing your medical information and the thoughts and the understanding that you have to some of the things like going to see your doctor on a regular basis, taking your medications on a regular basis, understanding the symptoms that a particular disease may have, or understanding what side effects certain medications may have, are all important. And if you share this information, then others may understand better how to take their meds or how to see their doctor, or even questions that they should ask their doctor once they go to their doctor. So it's all about community. Let's share, let's care for each other out there. Okay. Thank you. All the Facebook, all the Twitter, all the Instagram, and even going to the website. It's been wonderful. I'm telling you, I really appreciate all the response that we're getting out there. And just because I really appreciate that the show is getting out and really helping people. And it's getting to a point where I'm so happy that people come up to me and say, oh yeah, the show is so informative. We're going to keep it going for you because medicine is so important. We should all be better healthcare consumers. All right, guys. Thank you. Our Let's Talk segment. Oops, my stethoscope. Our Let's Talk segment. I want to talk this month, actually, is February. And February is Heart Month. And because it's Heart Month, I want to talk about cigarettes because cigarettes, put it this way. I would like to talk about quitting cigarettes, quitting smoking, because cigarettes is one of those habits that really leads to heart disease. It really does. So quitting smoking, very important, very important. The cost, number one, is phenomenal. Cigarettes are very expensive these days. Social acceptance. I mean, there are so many places that they don't want you to smoke. And you understand it's harm, or you're just doing harm to your body. The health, as far as smoking and the secondary smoke, the health of others around you, secondary smoke is real. And if you're smoking, the person next to you is breathing in the smoke as well. Setting an example for children. If you're a smoker, there's a good chance that the children that are looking at you smoking, they may be smokers in the future, okay? So how do you get to that point where you really want to quit smoking? What do you do? There's several things that you need to do, all right? You need to set a quit date, meaning that today, whatever that day is, that's the day you're going to stop smoking. All right. You need to tell family members and friends that you're going to stop smoking and let them assist you in that process. Okay. Anticipate and plan for the tough times, because there will be tough times when you want to really get back to that cigarette, but hold off because you're going to be successful at quitting smoking. And remove all cigarettes from your car, from your job, from your home. Just get rid of them. Don't be tempted to grab a cigarette, all righty? And talk to your doctor. See if there are medications that may actually assist you in quitting smoking. All right, guys. Very important, very important. Our topic tonight is pharmacy. And, we all go to the pharmacist. We all get the prescriptions from our doctor and we have to deliver it to the pharmacist. But what actually happens once it gets to the pharmacist? What actually happens on his end? That he makes sure that he gives us the appropriate medication, he gives us the right milligram strength, that he tells us how to take it, whether there are side effects. All these things can run through your head when you get your prescription and give it to the pharmacist. He is the person that we rely on to make sure that the medicine that the doctor prescribed gets to us appropriately and that we take it appropriately. And that's very important. I have a pharmacist here tonight. His name is Al Marshall, and he will describe all of this pharmaceutical well, put it this way, he'll give us all his pharmaceutical knowledge, and he's going to describe it from A to Z. We're going to talk through it. And Al, I'm just going to say, welcome to the show.
Thank you so much, Dr. Bay. Thank you for having me here.
Welcome to the show. I'm telling you, this
opportunity.
is such an important topic. And I'd just like to start off by saying, or put it this way, ask the question. And maybe you can just back up and very simply tell me, what does a pharmacist do? And just give me some idea of your thoughts, and when you're behind the counter, what a pharmacist does.
Okay, doctor. Basically, as you described, we're responsible for dispensing and compounding medications as written by the physician in the correct milligrams, dosage, and directions. I also like to say, in addition to dispensing medication, we also dispense information regarding the medications, because a lot of times patients will come and a lot of times they're a little bit intimidated at the doctor's office, and they might take the prescription, not ask any question, leave. And when they get to us, they realize the questions that they might have had. I mean, we get questions as simple as, well, what's this medication for? Right. Even though they've just left the doctor's office, and you know, I do understand that, and that's quite common. So we'll, in addition to dispensing the medication, we'll go over possible side effects, what the medication is for, the milligrams, you know, things of that nature.
Okay. Do you find that sometimes patients, because they're giving you the prescription and because they know they have a certain problem, that they're a little, and maybe not intimidated, but a little fearful to ask the questions? You understand, or a little, maybe even a little ashamed to ask the question.
Yes, and actually, as I said, quite often they have not asked the doctor at all. I don't know whether it's a matter of they're a little more intimidated by the physician than the pharmacist, and a large part of my job is really to you know, to interact with the patient or customer regarding the medication, especially if it's something new, something they haven't taken before. They want to know if it'll interact with anything that they're currently on, and if there are any side effects. Quite often, when they start on a new medication, I'll get a phone call possibly the next day, and they'll ask, you know, I'm not feeling exactly right. Could this be a side effect of the medication that I received, or things of that nature, and you know, and I usually, it's a matter of putting them at ease. You know, a lot of times with anything new, they start feeling what they think might be a potential interaction, things like that. But usually, it's not the case.
Tell me about milligrams. I know I'm talking to patients sometimes, and they'll say, "Doc, give me some antibiotics. Give me the strong ones. Give me the strong. I want the one that's 500 milligrams. You know, something like that." And I often tell them that one antibiotic family to another antibiotic family, the 10 milligrams can be stronger than the 500 milligrams. Yes. Tell me about that. Do you get that as well?
We get that quite often. It's funny that you should bring that up, but. A good example, like a Levaquin, you might prescribe a 500 milligram Levaquin, and so they're sort of fixated on that 500 milligrams to your point, and then you might prescribe something else which doesn't actually therapeutically, you know, switch milligram per milligram. It might be less of a milligram, and they're like, this is not what I had before. I had 500 milligrams, and I said, you know, you might have been on amoxicillin or some other medication at a lower dose, But you're right. That is common. That is common.
All righty. I want to go through interaction, the difference between interaction of medication to medication and allergies. Okay. Could you explain that for me?
Sure. And that is an important part of what we do. And actually, as we live in this computer age, it's really assisted pharmacists greatly in that way. In that sometimes you have medications that have what's known as cross-sensitivity, and I'm going to describe, I guess.
You had to break that one down for me.
Okay. Let's go over drug interactions. Okay. The doctor might prescribe a medication in a certain therapeutic category, meaning that it's a painkiller in let's say Percocet. Okay, and in Percocet, it's a combination of a couple of medications. You might have a an allergic reaction to one of the medications in there. Let's say the oxycodone.
Right.
Okay. So we document that on your profile.
Right.
So you might go to see a different physician, and now we have it documented on your profile who might, and you know that you're allergic to the Percocet. So you say, I'm allergic to Percocet. I want to try, or you might not say that to the physician. And the physician might prescribe something in the same therapeutic category,
Right.
but not exactly the same med.
Right.
When you bring it to us, we will actually get a alert on the computer that you had a reaction to this medication, to the Percocet.
Right.
This medication prescribed also, there's what's known as a cross sensitivity. If you're allergic to one, there's a possibility that you might be allergic to the other.
Right.
At which time, a call could be placed to the prescribing physician to see if they were aware of that. And a lot of times they might not be aware of it, and then they could say, you know what, I think I want to prescribe something else.
Right.
So in cases like that, examples like that is why sometimes it's important to see if you can use the same pharmacy and not really pharmacy hop, because the profile set up at one pharmacy sort of remains at that pharmacy. So if a reaction is set up in place at that pharmacy,
Right.
this is nothing that's actually shared amongst every single pharmacy.
Right.
So interactions, I often say, if you can, and I understand sometimes, you might go to one pharmacy and it's closed or whatever, and there might be another one, but to try not to just randomly use pharmacies as that you would want all of your records, as you'd want a doctor's records, in one place.
In one place, right. Now, allergies to different medications like penicillin.
Okay.
Alrighty. There are patients that come and say, I'm penicillin allergic and stuff like that. But there are a lot of different things that may have allergies. What do you recommend when patients say, I may be having an allergy to it? Do you recommend Benadryl, or do you recommend patients carry EpiPen or something like that? What do you recommend?
Allergies can be severe, as you know, as a physician, they can be deadly. So it's nothing to ever take lightly.
Right.
If it's a phone call, you find out what the symptoms are. I mean, with severe allergic reactions, we're talking about, swelling of the throat. Of course, they can be as extreme as to need what's known as an EpiPen, an epinephrine shot,
Right.
to save lives if the severity of the allergy is that bad. Most of them, quite often, Benadryl is an antihistamine. Antihistamines are generally what's used for low-level allergic reactions, similar to what you get with the allergies, like when the spring is coming, when you start having allergies to Benadryl, Zyrtec, Claritin, things of that nature, or what is known as antihistamines, and they're usually for mild allergic reactions.
Right.
So there is like a scale there, So if someone comes to me, it's generally a matter of finding out what we're talking about. They might say I'm allergic to penicillin, and I took amoxicillin, but I'm not allergic to that. Cross sensitivity, the word I used before. People that are allergic to penicillin can also be allergic to amoxicillin.
Right.
So that might not click in their brain, but I would hear it as a pharmacist and say, you might want to have someone bring you to the physician or to an emergency room, because you might be having a reaction to that amoxicillin.
Yeah. Let's talk about the date that's on the bottle when a medicine is outdated. I know that several of my patients come and they talk about, well, it's outdated, but I took it anyway. Yeah. What do you tell patients about this?
You really, here's a good example. A lot of times people might have a prescription for a cold or the flu or something they had of that nature.
Right.
Which is meant to be, the entire therapy might be, 1-3 times a day for 10 days. And quite often, as people do, they start feeling better, and they don't finish the therapy, and then this sits in their medicine cabinet, and then a year later they have a cold, and they're thinking, well, I took that last time and I felt better. Problem being is, now you don't have, first of all, you didn't take it the way it was prescribed the first time.
Right.
as you were feeling better, the physician did mean for you to continue to take that until it was all gone.
Right.
And so what often happens is now you reach in there and say, well, this made me feel better, but you might have 5 capsules left, which is not the way it was intended to be prescribed.
Right.
You know, a 10-day therapy was supposed to be the way it is. So my thought is always, no, if it was prescribed for something else acutely or a cold that you had before, you really need to not take that. You need to get rid of that. I know I didn't answer your question as far as dating.
Yeah.
But with that in mind, if you are taking something chronically,
Right.
there is no reason why it would be outdated. If you're taking one a day, you get a 90-day supply. The date is going to run out before it's expired. So generally speaking, if something is in the medicine cabinet that's outdated, it must be something that you're not taking regularly.
Right.
And probably you don't need to start taking it at that point, you know.
Okay. All right.
Most things that we dispense would have a shelf life of at least 3 years, you know. I mean, the pharmacies are regulated in that the Board of Pharmacy will come through and make sure that we have no outdated medications on the shelf. I mean, that
Okay.
Pharmacy
So
101.
Right. So
yeah.
they come through and actually make sure
Right,
that everything's
right.
above board as far as dates and stuff like that. So even with, I know I was reading something and they were talking about pharmacists. You guys make sure that the purity of the drugs and make sure that the strengths are appropriate. So that's sort of kind of what you're talking about as well.
Yes. Yes.
All righty. Now, what about as far as oh, there was a question. Don't worry, I'll come back to it. It just escaped me. It just left me. All righty. But we were talking about interactions, and we were talking about one of the things I wanted to talk about was when patients actually have a lot of medications. So many of my patients have an enormous amount of medications that they have to take, especially elderly patients.
Yes.
How do you have them take the medication so they can put it on a schedule that they can truly tolerate? Is that, I mean, it just seems to be overwhelming. I can't imagine taking as many pills as some of my patients seem to have. They have the bottles lined up. How do they actually manage that?
There are, well, the first thing, quite often what you see, one of the reasons I said it's good if possible to use a single pharmacy,
Right.
in that sometimes especially with elderly people where they have more than one physician, or they might have been at some point admitted to the hospital and discharged with prescriptions,
Right.
a lot of times you will get sort of, so to speak, overlap in prescriptions. A person might be discharged from the hospital. They're usually discharged with what they were taking in the hospital, and told to consult with their primary physician once they're out.
Right.
And a lot of times they will fill those prescriptions that they left the hospital with, not realizing that some of the prescriptions at home are actually what they're filling when they leave. So quite often in situations like that, if they're using a single pharmacy, you will see that, and you might say, well, Mrs. Jones, I see lisinopril is one of the prescriptions that you're trying to fill now, but according to our records, you have a 90-day supply that was dispensed
Right.
2 weeks ago. So this one we'll just put on hold, we'll keep for you because you actually should have that at home.
Right.
And you find that quite often because when they're being discharged, the hospital and the discharging physician want to make sure that they at least they don't know that they have a 90-day supply of that medication at home.
Right,
There's
right.
no way possible for them to know. And that's really where the pharmacy would come in. You might see 1, 2, or 3 of the medications they're being discharged with are items that they have had recently filled.
Right,
So to just dispense them, you can see where it could come in. Well, they'll have this lisinopril, they'll have the one at home from before,
Right.
and then they'll start taking both of them, which is definitely not the intention of the physician.
Right, right. Let me get into some of the details of actually, because there are a lot of things that happens at a pharmacy, things like copay. All right. I mean, the medications are so expensive now. Alrighty, and I know each insurance company they have their own rules about this and rules about that. And tell me about copays.
Okay.
What can you let me? How can you help me here?
Yeah. I tell you, when I several years ago, when I first got into pharmacy, it was really all about the dispensing of medications and the information on the medication itself. As time has gone on and the increase in the pricing of medications, I think I heard in 2014 the prescription prices, there was an increase of like 13%. I mean, we're talking about year over year increases. And what's happening with these co-payments is a lot of the insurance companies are pushing back a little bit and requiring the customer, the patient, to pay a larger percentage of what the medication actually costs, as opposed to them taking on the whole amount. So, you know, it is, as you said, a very complex thing. You have several different insurance companies out there. I mean, when you're in a pharmacy, every person that comes to you usually doesn't have the same insurance. So you might have someone in line who their co-payment for a particular medication could be $5, and the next person for the same medication, their co-payment could be, $20. You know, but it's all based on their insurance, what their insurance covers, what's preferred versus non-preferred under their insurance.
Preferred means that's the one that the insurance company really wants you to use. I want you to use this brand, of this medication.
Exactly, exactly. What I'm finding is so many people really don't have a good understanding of their own insurance as far as the prescription benefits part of it goes. Generally speaking, usually most of the insurance companies will send out a list, what's known as their formulary, which is saying
list of medications.
These medications, because what you have in you might have one medication, and there might be 10 to 20 other medications in that same therapeutic category. Meaning, like, it might be a category called an ACE inhibitor. There are several ACE inhibitors. Your insurance company might, of the 20 on the market, might prefer you use 10 of those 20 for pricing reasons, you know, for holding the cost down, for the benefits for everyone, you know, that is insured under that program. So what happens is you might get one particular drug in this therapeutic category, your copayment could be $10. Your doctor might decide to switch you up, not knowing, because doctors cannot know the ins and outs of every prescription insurance plan, and might say, well, let me try you on this other in the same therapeutic category, maybe it will work better. And then all of a sudden your copayment jumps up to $25, $35, and you're like, why is that? Comes down to that is a non-preferred medication under your plan versus the one you were taking before, which was preferred. You know, and I do a lot of explaining that to the customers.
What about prior authorization?
Prior authorization, that is a new term that has really blown up, I think, in the last 5 years. Prior authorization is where an insurance company or your prescription benefits will, they are saying that we will cover this particular medication, but only under certain conditions. And so what happens is when I'm presented with that prescription and I enter it into the computer and adjudicate that claim to your insurance will come back with this message to me saying the doctor needs to be contacted and fill out these appropriate forms before this medication is going to be covered. And at that point, when the forms are filled out and sent to the insurance company, and this whole process can take as much as 48 hours, the insurance company has to actually make a decision on whether or not they're going to cover it for you, for that patient or not. And basically, a lot of this is around, because as you were saying before, medications are getting extremely expensive. I mean, you might have a copayment for $25 or $30, and actual cost of the medication could be as high as $600, $700, $800. You're not aware of this because you're just paying your copayment. But behind the scenes, there's your insurance company actually footing the bill for that. So in recent years, as these prices have increased, prior authorization has become a bigger part of pharmacy. You know, they're saying, you know, we're going to cover it, but we need to check out, exactly if this is the necessary medication for this person.
Right.
And so it becomes a thing where I think that's a lot of my interactions with physicians, as you well know, are calling up to go over prior authorization for different patients.
Mm-hmm. Tell me about coupons. Patients always getting these coupons and they're coming in, I'm sure, to you all the time. I know we physicians get them from the pharmaceutical companies and we give them to the patients and the patients give them to you, but they don't always work with every.
Yeah, there are different types of coupons out there. There's the discounted coupon of, like, you might go online, you say you'll get 15-20% discount. Mm-hmm. Those often are basically if you don't have insurance, because unfortunately if you have a copayment, that 10 or 15% off of a medication mm-hmm. won't work generally with an insurance company. Okay. Now the other coupons, like where you might have a free sample that quite often come from the physician because the pharmaceutical rep has given it to them. The unfortunate part of this quite often is you bring that free coupon in and the person might get a very expensive medication for free because the pharmaceutical company is paying for it. Then when they come back for their refill, that's a one-time deal. Now we have to jump over the fence and use their insurance.
Oh, boy.
And then that opens up a whole other can of worms, which could be prior authorization, as we described earlier, where all of a sudden we realize it's not covered, and I have to go back to the physician, doctor, I know you had them on this particular medication, but their insurance company this time is requiring you to fill these extra forms.
I hate to cut you off because we are just about out of time.
Okay.
We've run out of time. But we're going to have to talk more about this. Thank you so much for coming in and doing this show on pharmacy because it's so important. Oh my goodness. In closing, remember guys, sharing and caring. Go out and do something special for somebody just because you can. Not because you're going to get a reward or not because it's something that's going to make you feel good, but just because you can. Never institute any change in your medical therapy until you check with your physician. I trust each and every one of you continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all. All right.